This segment of Delmarva Life is brought to you by Peninsula Home Care.
You know, when it's flu season, we talk a lot about influenza prevention measures and treatment, but some illnesses don't necessarily have a season, which means we are vulnerable to them all year long. Pneumonia is one of those illnesses, and people who suffer from chronic obstructive pulmonary disease, or COPD, are at a much higher risk for getting pneumonia. Roughly 15 million adults in the U.S. have been diagnosed with COPD, but there are millions more who may have it and don't even know it. Joining us to tell us more about the risks of pneumonia and COPD is Beverly White, Branch Director of Peninsula Home Care at Nanticoke. Thank you for joining us this afternoon.
Thank you for having me.
All right, we know that people with COPD, they have difficulty breathing, but why are these people more likely to develop pneumonia?
Well, people that have COPD have thinner airways. When the airways thin because of the disease, it causes mucus to slow down. Mucus trapped in the airways then becomes the perfect home for germs that cause pneumonia, puts them at a much greater risk.
So they may not necessarily go seek treatment because they think it's just the COPD?
They often do. The difficulty breathing usually happens first. They already experience some of that with their COPD, so they may not think to be mindful of other symptoms that could increase their risk for pneumonia.
Let's talk about pneumonia a little bit. The symptoms. What symptoms are more distinctive with pneumonia?
They are very different. Pneumonia more commonly might start off with a change in what we consider sputum. Sputum is the mucus that people tend to produce when they cough or clear their throats. It's normally white in color, but what happens is that when you start developing pneumonia, it changes. It becomes thicker. It's maybe yellow or green in color, even sometimes blood tinged. That's often followed by high fevers, cough, chills, other symptoms that are not common for people that just have COPD.
And the prescription drugs that you use for COPD and pneumonia are different as well. I mean, the
Yes.
prescription drugs for COPD won't work for pneumonia?
No, they are very specific to managing the symptoms that you have of your COPD. Pneumonia requires antibiotics, oftentimes even intravenous antibiotics that can be administered at home, but more commonly in the hospital or at home with a home care nurse.
Now, something you use you actually have a device that you use to help people measure their breathing?
Yes, a spirometer is a device that measures rate of inhalation and exhalation, how you move your air, as well as lung capacity. We know that when people take in really good deep breaths, they are able to move good air, the lungs are healthier, they stay well inflated. It cuts down on that thinner airways that we were talking about earlier and decreases that mucus that gets trapped there, decreasing your risk of pneumonia. So that device is often provided to people so that they can practice that good deep breathing, because most people don't breathe well enough on their own when they have COPD.
Okay, but of course with most everything, prevention is key. You can actually prevent pneumonia?
Absolutely. I think the prevention is always, I think, your first measure of best defense. I think knowing the difference in symptoms between COPD and pneumonia are your best chance. Knowing when symptoms change, especially like sputum color, fatigue, change in your ability to breathe. When people have COPD, they're already at risk for respiratory failure, and that respiratory failure is the deprivation of oxygen, that you're not getting enough oxygen in, or you're not expelling enough carbon dioxide. That then poses complications for other bodily systems to be negatively impacted by the lack of oxygen. If you notice that starting to happen, you should be calling your healthcare providers immediately, because again, we know that lack of oxygen will cause other problems and increase your risk of pneumonia significantly.
Yeah, you do not want pneumonia.
No, you don't.
And just, of course, stay healthy. Eat
Yes,
healthy.
absolutely. Yep.
Beverly, thank you so much. Good information.
Thank
If you would
you.
like to read more about Peninsula Home Care, go to delmarvalife.com now.